Yes. Hi, my name's Tia. I'm going to show you how to perform immediate care of the newborn. So the doctor just handed me the newborn, and I'm going to go ahead and place it in a position to facilitate drainage. I'm going to go ahead and suction the mouth and the nose, and I'm also going to be rubbing down the baby with warm blankets and towels to stimulate crying and dry them off. So next I'm going to lay the baby down under a warmer, and I'm going to make sure the baby does not go into like cold stress or anything, and I'm going to continue rubbing down the baby with warm towels to dry it off, and I'm going to begin by wrapping and things like that, wrapping and drying it and keeping it under the warmer. So next I'm going to move on to, I'm going to assess the infant's APGAR score, and I'm going to go ahead and listen to apical pulse for 1 minute. I'd want to perform an APGAR at the first minute of life in the 5 minutes. So I'm going to listen to apical pulse for 1 minute. After I do that, I'm going to assess the infant's respiratory status. I'm going to make sure that the chest is rising and falling as it should. I'm going to look at the muscle tone of the infant and the color of the skin. I'm going to look at the extremities for cyanosis, which is common in a newborn for the first minute. I'm going to look at, maybe do a startle for the baby and see if the startle reflex is that the baby does tense up. So after I've done the APGAR, I'm going to assess the infant's cord. I'm going to look at it and make sure that there's no signs of bleeding and all the vessels are present. Next, I would move on to vital signs of the infant. I'm getting a little winded. I'm going to look, assess the temp, axillary, never-rectal. I'm going to perform do a BP on the infant with the appropriate cuff size. I'm going to look at the brachial and femoral pulses, and then I'm going to make sure that the infant is not in respiratory distress and that everything is good with that. So next I'm going to move on to a head-to-toe assessment. I'm going to look for any signs of lanugo, and I'm set the baby up and look at the from frontanelles for any that they're not risen or sunken in. I'm going to look for any signs of molding. I'm going to look at any abnormalities in the face, head, extremities. I'm going to make sure that the scalp is okay, and like I said, that there's no molding and that the frontanelles are not sunken or risen up. They want to be flat. So next I would move on to look at the reflexes of the infant, make sure that there's no abnormalities with that. I want to make sure that the skin and color is good. I'd also want to do the sucking reflex and place a finger in the infant's mouth to facilitate sucking. So next I want to move on to length and measurement of the baby. So I would want to do the length of the baby first from head to toe. This infant is 20.5 inches, and I could also take the measuring tape and measure over right above the eyebrows and around the head for the circumference of this head, which this measurement is appropriate for the newborn. And also I'd want to measure the chest of the infant, and this measurement is also appropriate for the newborn. Also I'd want to also get a weight of the newborn while it's not diapered. I would pick it up and I'd set the scale to 0. I'd place it flat, and I would keep my hand over top of the newborn to make sure it does not roll off. So this baby is 8 pounds, which is a good weight. I could go ahead and take an alcohol swab and give a vitamin K shot. So I'd do that in the vastus lateralis. So next I could also go ahead and perform a heel prick in the foot for the glucose reading. So I do that, and I can go ahead and diaper the baby and swaddle it. I can make sure that the infant's band is the same as the mother's and that all the information matches up. So next I could diaper it and swaddle her, him or her, and I could go ahead, clean the eyes with cotton balls, and I could put the ointment from inner to outer, before doing a ribbon of the antibiotic ointment. So everything looks good with this infant, and I've given all the medications necessary. And then we can also let the mother perform kangaroo care with her new baby. So the baby is diapered and swaddled, and it's handed to the mother. Thank you.